Welcome to Health U, the greatest breakthrough in radical prostatectomy in 120 years. From a terrifying surgery with extremely high mortality rates, transforming into precision medicine that saves millions of men, with 2020 treatment guidelines completely revolutionizing care, helping 40% of patients avoid unnecessary surgery. Dear viewers, today I want to share with you one of the most shocking evolutionary stories in medical history. Radical prostatectomy, a surgery that once struck fear into the hearts of men, has undergone 3 revolutionary transformations over the past 120 years, ultimately evolving from a dangerous procedure almost equivalent to a death sentence into a paradigm of modern precision medicine. Let's begin with a shocking fact. Before 1980, radical prostatectomy was one of the surgeries that surgeons feared most to perform. Why? Because the surgical procedure was often accompanied by massive bleeding, patient survival rates were extremely low, and even if patients were lucky enough to survive, they often faced the devastating consequences of lifelong incontinence and complete loss of sexual function. This surgery was first introduced around 1900 using the perineal approach. Imagine, in an era without modern anesthetic techniques, precision instruments, or adequate blood transfusion equipment, surgeons had to make incisions in the patient's perineum and penetrate deep into the pelvic cavity to remove the prostate. The surgical risks were so high that many doctors dared not attempt it lightly. In 1948, the medical field welcomed its first reform. The retropubic radical prostatectomy was formally described and promoted, approaching through the patient's lower abdomen, representing an improvement over perineal surgery. However, even with this advancement, until 1980, this surgery remained a gamble. When patients and families signed surgical consent forms, their feelings were as heavy as signing a life or death warrant. But let's fast forward to modern times. Today's radical prostatectomy has become a relatively safe surgery with extremely low complications. How did this transformation occur? The answer lies in the crucial year 2000. In 2000, medical history welcomed its third and most important revolution, the birth of robot-assisted radical prostatectomy. This breakthrough completely transformed the entire surgical landscape. The precision of robotic arms far exceeded that of human hands, capable of performing extremely delicate operations within the narrow pelvic cavity, dramatically reducing blood loss, shortening recovery time, and most importantly, significantly improving patients' postoperative quality of life. Consider this comparison. Patients before 1980 might need weeks or even months to recover basic activities after surgery, often with permanent complications. Now, robotic surgery patients can typically be discharged within a few days after surgery, and most can maintain normal urinary function and sexual function. This isn't gradual improvement. This is revolutionary advancement. But the story doesn't end there. In 2020, the authoritative journal Nature Reviews Urology published a landmark study revealing another shocking discovery. We may have been performing too many unnecessary surgeries in the past. This study pointed out that for patients with low-grade, low-volume Gleason 6 prostate cancer, surgery is no longer the recommended treatment approach. What does this mean? It means that over the past several decades, approximately 40% of newly diagnosed prostate cancer patients, millions of men, received surgery that was actually unnecessary. They endured surgical risks and complications, but the cancer itself posed no threat to their lives. This discovery stems from advances in modern molecular biology. Scientists can now more accurately identify which prostate cancers are indolent, cancers that grow extremely slowly and don't threaten life. For such patients, active surveillance has become a better choice, involving regular monitoring and close observation to avoid unnecessary surgical trauma. So, which patients still need surgery? Current medical guidelines are very clear. Patients with intermediate to high-risk prostate cancer with Gleason scores of 7 to 9 or grade groups 2 to 5 still require aggressive surgical treatment. The goal of these surgeries is not only to remove tumors, but more importantly, to prevent potentially lethal cancer cell clones from further metastasizing. Even more exciting is that modern radical prostatectomy is no longer a standalone treatment approach. It's increasingly being used as the first step in multimodal therapy, even in some patients with early metastatic disease. Small-scale studies show that for patients with small metastatic burden, including lymph node or bone metastases, incorporating radical prostatectomy into multimodal treatment plans may bring unexpected therapeutic effects. There's another interesting phenomenon worth noting. With population aging and advances in medical technology, more and more elderly patients are beginning to undergo radical prostatectomy. Research reports show that now even healthy elderly people over 80 years old receive this surgery, whereas 20 years ago, such patients, even if diagnosed with locally high-risk prostate cancer, were rarely considered for surgical treatment. What does this change reflect? It reflects the significant improvement in surgical safety and our re-understanding of the concept of age. Age is no longer an absolute contraindication for surgery. Comprehensive assessment of overall health status, comorbidity conditions, life expectancy, and other factors has become more important decision-making criteria. However, some might ask, since drug therapy continues to advance, with various new prostate cancer medications emerging constantly, is surgery still necessary? The answer is yes. Although medical treatment options are indeed constantly increasing, radical prostatectomy still plays an irreplaceable role in the 21st century. The reason is simple. For appropriately selected patients, surgery remains the treatment method, providing the highest cure rates. More importantly, the demographic characteristics of prostate cancer are changing. With population aging, improvement in diagnostic techniques, and increased public health awareness, we face a completely different patient population. These changes make radical prostatectomy not only still important, but also continuously evolving in its indications. From a technical perspective, modern robot-assisted surgery has achieved amazing precision. Surgeons sit at control consoles, manipulating robotic arms to perform surgery, like conducting highly precise microscopic operations. The robot's hands are more stable than human hands, with clearer vision, capable of performing delicate movements that human hands cannot accomplish. This technological innovation brings not only improved surgical success rates, but more importantly, improved patient quality of life. Most current radical prostatectomy patients can maintain good urinary control and sexual function postoperatively, which was completely unimaginable 30 years ago. From a historical perspective, the evolutionary process of radical prostatectomy is actually a microcosm of the development of modern surgical medicine. From early brutality and danger to current precision and safety, these 120 years of change have witnessed the explosive growth of human medical knowledge. Advances in anesthesiology made long, complex surgery possible. Development of blood transfusion technology made massive bleeding no longer a lethal threat. Revolutionary imaging allowed surgeons to clearly understand each patient's anatomical structure before surgery. Breakthroughs in molecular biology enabled us to more accurately predict cancer behavior. The introduction of robotic technology integrated all of this to an unprecedented level. Modern radical prostatectomy has become a typical representative of precision medicine, based on personalized molecular diagnosis, selecting the most suitable patients, using the most advanced technology to achieve optimal treatment effects. However, technological advancement doesn't mean we can ignore the inherent complexity of this surgery. The prostate is located deep within the male pelvis, surrounded by important neurovascular structures. Even with the most advanced robotic assistance, this surgery still requires high skill and extensive experience. This also explains why there's a clear correlation between surgical volume and surgical outcomes. Experienced surgeons, especially those specializing in prostate surgery, achieve significantly better surgical results than doctors who occasionally perform such surgeries. The existence of this learning curve reminds us that no matter how advanced technology becomes, the human factor remains irreplaceable. From the patient's perspective, the experience of modern radical prostatectomy is worlds apart from the past. Past patients faced large surgical incisions, long hospitalizations, lengthy recovery periods, and uncertain postoperative complications. Current patients only need minimally invasive surgery, can usually be discharged 2 to 3 days postoperatively, and most can return to normal life within weeks. More importantly, modern patients have more choices. Through detailed preoperative assessment, including imaging studies, pathological analysis, genetic testing, and more, physicians can develop personalized treatment plans for each patient. Some patients are suitable for active surveillance, some for surgery, and some may need multimodal approaches combining radiation therapy or drug treatment. This concept of personalized medicine is the core characteristic of 21st century medicine. We no longer believe in the old notion that one treatment fits all, but instead develop the most suitable treatment strategies based on each patient's specific situation, including tumor characteristics, physical condition, personal preferences, and more. Returning to the research itself, the article published in Nature Reviews Urology is not only a review of the history of radical prostatectomy, but also forward-thinking about future development directions. It reminds us that medical progress is not only reflected in technological complexity, but more importantly, in accurately grasping patients' true needs. Both overtreatment and undertreatment are extremes we need to avoid. For patients who truly need surgery, we should provide the best surgical technology and most comprehensive perioperative care. For patients who don't need immediate surgery, we should have confidence in choosing watchful waiting, avoiding unnecessary trauma. This art of balance is the essence of modern medicine. It requires us to have not only superb technical abilities, but also profound clinical judgment and humanistic care spirit. Looking to the future, radical prostatectomy will continue to evolve. Artificial intelligence may further improve surgical precision. New robotic technology may make surgery even more minimally invasive. More advanced molecular diagnostic techniques may enable us to more accurately predict the behavior of each tumor. But regardless of how technology develops, one thing won't change. The core goal of VITR-S surgery is always to improve patients' quality of life and survival. Technology is only a means to achieve this goal, not the goal itself. The 120-year evolutionary journey of radical prostatectomy provides us with the greatest insight. Medical progress requires time, requires the efforts of countless physicians and scientists, and requires the perfect combination of technology and humanities. From the first surgery in 1900 to today's robot-assisted surgery, every advance is built on the foundation of predecessors' experience. For male friends facing prostate cancer diagnosis, this story conveys a hopeful message. Modern medicine now possesses unprecedented weapons to combat this disease. Whether choosing active surveillance, surgical treatment, or other treatment modalities, all have scientific basis and rich experience support. Most importantly, every patient should work closely with professional medical teams to make the most appropriate treatment decisions based on the latest medical evidence and personal specific circumstances. In this process, full communication, detailed assessment, and in-depth understanding of different treatment options are all crucial. The story of radical prostatectomy continues to be written. With continuous advances in medical technology, we have reason to believe that future patients will achieve better treatment outcomes and higher quality of life. This is not only the result of technological progress, but also the embodiment of the entire medical community's persistence in the concepts of precision medicine and humanistic care. This is the complete story of 120 years of radical prostatectomy evolution. From a terrifying surgery under the shadow of death to a paradigm of modern precision medicine. It proves what medical miracles human wisdom and persistent effort can create.